Hello, welcome back. This is the 7th installment of my progress with the Incognito braces. The topic of today is extractions. I got the extractions several weeks ago, and I want to talk you through that, the progress of that, as well as show you what that looks like. So, first of all, I want to talk about the anesthesia that I chose to do. I decided to do local anesthesia instead of general anesthesia. I mentioned that in my last video. And the reason why I decided to do that were two reasons. One was I received a letter from the dental office in advance of the procedure, just warning me of the side effects and possible risks with general anesthesia. So it seemed like there's definitely a much higher risk of reaction, of adverse reaction to general anesthesia than to local anesthesia. With general anesthesia, obviously they put you fully to sleep, and local anesthesia is just numbing the area around which they're going to operate. So that was one factor. The second factor was cost. General anesthesia cost $500, or did it in the place where I was going to get it done, and the local anesthesia is free with the extractions. More about cost. The extractions cost, I called two different places, and they were between $250 and $300. Now, the place that I went with, in the end, they were going to submit directly to my insurance, and I only had to pay the 20% deductible up front. Whereas the second place, they wanted to have me pay everything up front, and then they would submit to the insurance, and the insurance company would reimburse me directly. So I went with the case where I would have to pay less up front. The cost, the upfront cost ends up being $270 about. So not too bad compared to the original cost that I was looking at with the general anesthesia and the extractions up front, which would have been $1,800. So let's get on to the procedure. I went in for the extractions. I didn't do any preparation. With local anesthesia, I can eat before getting the extractions. They actually advised that I do, because they said I would be hungry later, and my teeth would be very sensitive, obviously, and I would be limited to liquids. So I ate in the morning, and then I went in to have the extractions done. I was really nervous, and they did a lot to prepare me and to make me feel a little bit more calm. And then I just proceeded to inject the local anesthesia around my teeth, and they gave me a lot of shots. I think in each tooth, or like on the outside and the inside gums, they probably gave me 5 shots outside, 5 shots inside for each tooth. And then just waited and talked to me as the numbness set in. And then the dentist tested to make sure that the areas were adequately numb by poking at them and seeing if I could feel. I'm glad that I did the local anesthesia, because when the extractions were taking place, the dentist was, doing a bit of wiggle and a bit of pull, and there was a lot of force to the pull. And I think that if I wasn't conscious, then obviously I wouldn't be able to resist the force with which he was pulling, and I was really having to resist. Otherwise, they would have had to have the assistant, I think, hold me down and hold my jaw so that they could resist the force of the pull. And I think being awake it was easier to get a better angle to apply that force. Now, one of my teeth, the first tooth that was being extracted, as it was being extracted, the root broke. Or it was like this tooth had a split root. So instead of being one base of the tooth that shows outside of the gums and one root, it actually had a split root, and one of them broke during the extraction. So the dentist had to drill in and pull that bit out. I didn't feel any pain. The most painful part was getting the shots, getting the injections, and it was only the first couple of injections that hurt, and it really didn't hurt that bad. It was like a bad pinch. Okay, I still remember how it felt, so it must have hurt enough. But the extractions didn't hurt at all. So and it wasn't shocking at all to feel the tooth being dislodged from my jaw. So I would recommend actually just doing the local anesthesia. It was not bad. If you're getting these teeth pulled that that have a single or double root. But if you're trying to get teeth pulled that have the 4 roots, that's a different case. I don't know. I know that when I got my wisdom teeth pulled, I did general anesthesia because my teeth were highly impacted, and I don't know. Excuse me, if I could have handled the work that they were doing in that case. So what else? Let me just show you what it looks like. So those 4 teeth are gone. I was worried about how it would look, and I do have a large smile, and people do notice it. And I was gonna get my orthodontist to put the build-ins in, which are like, they look like other teeth and they attach to the front tooth. He didn't want to do it because it gets like it doesn't go all the way up to the gum, and so food gets onto the top of it, and it's not as hygienic and all the stuff. So he didn't want to do it. I think he was just, until I got the extractions, he was just telling me that he would do it just so he could change his mind later on, and I wouldn't have a choice. However, it doesn't matter. I've been comfortable with my smile, and even when people notice, I don't really care. So, or I explain to them, oh, I have braces. But I probably am smiling a little less wide though, especially when I'm meeting new people. So you don't want to get it shocking, like mouth missing teeth when you first meet somebody. So that's not too bad. I'll actually show you what it looks like with my mouth open. Okay, so let me know if that was adequate. If not, I can do some more videos of that and some more pictures. The other thing about the extraction, so let me talk about wrapping up. When I finished getting the extractions, I was okay. I was still numb, but my face was completely swollen, and they put cotton balls into my teeth. The dentist said that my gums were clotting really well. You could tell, it's like, your gums are very healthy, everything is clotting well, you won't have any problems. And actually, when he put the cotton balls in, I wasn't getting a lot of blood. Then he gave me a prescription for ibuprofen, 800 milligrams. Oh, sorry. No, he gave me a prescription for a painkiller that was no longer available at the pharmacy. I'll talk about that in a minute. And he gave me a prescription for Vicodin. I went to get those prescriptions filled directly after leaving the dental office. And I had to wait like 45 minutes for the prescription to be filled. And in the meantime, all of a sudden my teeth started bleeding, my gums started bleeding. And, I was at the cash register actually, and then I just started getting blood dripping all over the counter, and it just started really gushing out. And so I had to run to the bathroom, and the dentist had given me a bunch of gauze. So I wrapped that up and tried to continually replace the gauze in my mouth. I may have dislodged the blood clot, but then it started happening in all of my teeth. So I think that it was just, maybe my gums were just in shock and not ready to bleed until after I got out of the dental office or something. But for the rest of the day, I bled an enormous amount, and I was worried that I wasn't clotting. In terms of food, I could only have liquids, and I didn't have anything until much later that day, just because there was still so much blood. And I even used all of the gauze that the dentist had given me within the first hour, and I had to go out and get more gauze and apply that. Now, if you go and do this, I would recommend that you ask your dentist if they can give you the prescription before you get your teeth pulled, and then go fill the prescription so that you have the medicine, and then when you get the extractions done, you can just go straight home. having to make the stop at the pharmacy and wait there for 45 minutes was such a pain in the butt. You know, and my face was all swollen, I looked terrible, and I couldn't talk, and all I wanted to do was lay down and pass out, and I couldn't do it. So, I definitely try to, if there's any way possible, get your prescriptions filled beforehand, or get somebody to run out and get them for you after you get your extractions done. The other thing was that later on in the week, I had a lot of pain with the extractions. It was an enormous amount of pain. So I must have dislodged my blood clot. You're not allowed to use a straw, you're not allowed to sneeze, you're not allowed to suck, you're not allowed to rinse. However, I think it's that sucking bit that that may have been my detriment, because since I gotten the brackets in, I was subconsciously sucking at my brackets all the time. And when I got the teeth extracted, I think I was probably doing the same thing. And it was either that, or when I was trying to rinse my mouth, I was trying to do that several times a day. And I did start using my water pick at some point. It could have been any one of those things, but I ended up getting dry socket, and for the rest of the week while I was out of town for work, I was just in a ridiculous amount of pain. At first, I wasn't taking any of the medication. I took maybe one ibuprofen after the procedure, but other than that, I wasn't taking any of the medication at first, and I was feeling fine. But all of a sudden, a couple of days after, I was in a lot of pain, and I couldn't sleep without the Vicodin, and I was taking 2 of the 800 milligram ibuprofen twice a day, so 3,200 milligrams of ibuprofen, and sometimes I would do 3 doses a day, just to get by, because I was not able to function without the medication for about a week. And then I went back to the dentist when I got back into town, and said that everything was starting to heal again normally, and he just gave me more medication. And then I went to see my orthodontist the same day to get the wires put in. So that was my experience. Definitely a lot of pain after the fact, not a lot of pain during the extractions. And like I said, if you can, try to get everything together beforehand, and also try to get some liquid food ready before you get the extractions. So some cold things like some smoothies or ice cream, preferably without any little bits that can get caught into the gums. Soups, even just anything without any, like I said, that's just liquid, that's easy to swallow. You don't have to chew. And again, you can't use a straw, so keep that in mind as well. Okay, post any questions you have. Talk to you soon. Bye-bye.